Good morning, everyone. This is Jong speaking. I'm working at Dalhousie University as an assistant professor and director of the Health and Environmental Research Center Laboratory. I'm glad to hear that Dr. Paul Jones talking about some toxicology work. So I'm specifically focusing on the nanotoxicology, which is toxicity testing of the nanoparticle. So in our lab, we deal with lots of different priority and emerging contaminants, including heavy metals, speciation analysis, as well as the pesticide and VOCs, PBDs, but I'm particularly interested in the nanoparticle toxicity. I consider nanoparticle as an emerging contaminant. I want to show you why. So first, I'd like to introduce my laboratory. Actually, the Dalhousie laboratory is one of the three national centers in Canada to study about the aerosol research network to enable collective study of the climate and air quality and population exposure and human health. It was created using the research award and matching research from Canada Foundation for Innovation, as well as the industry partners such as the Thermo Fisher and Perkinamer. So we have a full spectrum of analytical instrumentation such as LC-MS, which is Orbitrap Exacerbated Plus, and also we have ICP-MS for heavy metal analysis. We also have the GC-MS as well as HPLC and IC. So we do a lot of the clinical research as well to analyze the clinical sample, including urine sample and blood samples for identifying biomarkers for disease, as well as we have a full spectrum of real-time environmental quality the monitoring equipment as well. So as you can see, ambient metals monitor, basically we can measure and identify 42, 24 heavy metals in ambient air in real time. And also we have lots of different air gas monitoring equipment as well. So we try to better understand how emerging hazards and exposure lead to adverse health outcomes at various levels of biological organization, from cellular to molecular level and population level as well. And also we try to understand how the human body modifies this response to maintain homeostasis. We call host defense. So as you may know, the chemical can exist in different settings, in occupational settings as well as in clinical settings. That's why our three main research area is going to be in workplace, to looking at what kind of hazard out there, how much is there, including welding fumes, metal-based nanoparticle as well. And also we're dealing with the clinical samples to identify biomarkers for disease and exposure assessment as well. So we're dealing with the hazard and exposure and health outcomes. So integrate all the data together and disseminate all our data to the stakeholders to improve health. So I'd like to start with some of the cartoons regarding the where we live. Actually, this is not where we live. As for example, just here is the washroom. They show us kind of indicating the progress we do in restroom, but which is not realistic at this point. The point is we receive lots of good or new technology information. Is that all good? Yeah, potentially they bring a lot of good benefits in our daily life, but at the same time, there is no perfect in terms of risk and toxicity. So one of them is nanotechnology. So nanotechnology bring new benefit to our daily life, but at the same time, they create uncertain risk. So we call the nano risk. So right now, there is a controversial, but just the thing is right now, there is no regulation. So because the manufacturer are not required to report the inclusion of nanoparticle they use in their product. So it is almost impossible to identify what kind of particles in our product and how do we avoid potential exposure of the nanoparticle. We don't know yet. So that's why in our lab we would like to interest the potential toxicity of the nanoparticle using some of the thermal fisher equipment as well. So we are using the ICAP-Q, ICP-MS to measure metal concentration in animal model as well as cell models. So then what is nano? Basically it's really, definition is the size. So any material is less than 100 nanometer, which is we call the nanoparticle, nano material. So engineered nanoparticle is actually, engineerically we synthesize the particle which is smaller than 100 nanoparticle. As you can see, the nanoparticle size is so small, even we cannot use just a regular microscope to see the nano-sized particle. So human DNA is a 2.5 nanometer, which is we're dealing with that nano-scale. So the human hair diameter is maybe just 1 micrometer. It's 1,000 small or 10 times or 100 times smaller than that scale we're dealing with. So then why is it so special? Why we have to use nanotechnology? Because they're so small size, they can bring the new property. For example, even though the same size of the nanoparticle, like silver 100 nanometer and silver 120 nanometers, different size, they show different color. So the size is a matter. So nanoparticle bring the new property based on the size. Another the property for nanoparticle is they bring the huge surface area. So the same mass, the huge surface area, so they can provide a lot of reaction site. So you can easily understand how. So the gum, when you stretch out, even though the same volume with the sweat, but still they have more opportunity to interact with air, so dry fast. So that's why the benefit of the small systems. So doing more with less amount because they have huge surface area. So right now, so you can find nanotechnology in many different applications. One of them is environment as well as medicine and security and energy. Like I said, there is no regulation regarding to health impact of nanoparticle. So the potential health impact, as I mentioned before, the nanoscale is so small. At the same time, they're dealing with just really important biological molecules. One of them is DNA. So human DNA, 2.5 nanometer, a lot of protein and gene, their size is really small, right? So for them, when nanoparticle enter human body, they thought, is this a DNA or is this a biological molecule? They get confused. Might they can interact with each other? May they confuse them as a biological molecules? So we called potentially we anticipate a lot of interactions between the nanoparticle and biological molecules. So the risk is actually function of a hazard and exposure. So even though there is a hazard without exposure, theoretically there is no risk. That's why we are interested to figure out first exposure. So the human exposure to nanoparticle can occur different pathway, such as skin, thermal contact, and inhalation, and gastrointestinal tract ingestion, or by injecting as a formulated medicine. Because right now it's nanomedicine. So in the medicine, they use nanotechnology to deliver certain drug to the cancer site. So that's why they can use nanotechnology to inject the drug in nanoparticle as a carrier. But the most critical concern over health and environment effects is when nanoparticles are aerosolized. Because so small, they're highly mobile, they can easily enter human body through inhalation. That's why we're focusing on the inhalation exposure pathway for nanoparticles. And even though the once nanoparticle deposit in the lung, they can translocate from lung to secondary organ. One of them is brain system as well, because they can reach out to the bloodstream and then they can go to different organs. So currently the challenge of the testing in nanotoxicology is basically current toxicity testing method is developed for a long time ago for chemicals. Like I said, the nanoparticle is different than chemicals. It's not solid. Some of the nanoparticles is really easily solved, but nanoparticles are different than chemicals. And their properties completely new properties. Like I mentioned before, that's why we are interested in using nanotechnology. But the thing is, right now, our current toxicity testing method is validated for evaluating new materials. We don't know yet, right? So in general, toxicity testing model is there are two ways. So you can use human cells to looking at the toxicity of the nanoparticle and other chemicals. And in vivo model is, we said, just animal model. So you can use animal to test toxicity of chemicals, including nanoparticle. So two different way to, they have each kind of strengths and limitation. So I can show you what the difference is actually. So the U.S. the National Research Council, they publish the toxicity testing 21st century. This is really good Bible for toxicologists for chemicals and nanoparticle toxicity testing method. So one of the criteria is broadest coverage of the chemicals and the fewest animals and lowest cost. So for in vivo model, we don't want to use a lot of animal for testing all the nanoparticles or chemicals on the market already. So right now, there are more than 5,000 consumer products containing nanoparticles. So we cannot use animal model to test all the nanoparticle toxicity testing. That's why in our lab, we are focusing on the in vitro model and in vivo model. So basically, we want to use in vitro model to screening the just toxic ranking of the nanoparticles for in vivo model. So that way we can reduce the animal number as well as the cost. So even in vitro model, in vivo model, I want to discuss first. So primary toxicity assessment, like I mentioned before, we thought human exposure to nanoparticle is mainly through inhalation. That's why we are focusing on the primary toxicity. And we are using the in vivo model that normally they do is two components. One component is a bronchial alveolar lavage fluid evaluation and then lung tissue analysis. So what is the BAL? We call the BAL. Actually, saline solution is the human physiology solution. So we use the saline solution, wash the lungs, and that is the solution, and including the fluid as well as cells. The fluid, some of them is cytokine, chemokine, the LDH, one of the cytotoxicity indicator. That the level is go up, then we say, okay, that's the material-induced toxicity. And then cells, we call total cell and different cell numbers. So one of our in vivo work I want to introduce. So human exposure to nanoparticle can occur simultaneously. So we would like to see what the effect of copper nanoparticle exposure on bacterial clearance. To do this study, we basically do inhalation study of the nanoparticle using the mice. And there are two different exposure ways. So one of them is we call inhalation exposure, whole body exposure. Basically, whole body chamber, exposure chamber, we put the mice is there, we deliver nanoparticle. So mouse, just breathe naturally and they are exposed to nanoparticle. That is inhalation exposure. So inhalation exposure is actually we deliver nanoparticle through the trachea of the mice, and we want to see what the response is. The reason we want to use two different methods is each method has a strength and limitation. So whole body exposure, you can see more kind of mimicking realistic exposure scenario for humans, which is good. But they some of them is maybe just a thermal contact or ingestions, not mimicking a whole inhalation exposure scenario. That's a limitation. And installation exposure is more kind of a uniform the delivery of nanoparticle in the cells, because we deliver nanoparticle through trachea directly. So more deposition, more delivery efficiency as well. So that's why we want to see if the different exposure way to induce a different toxicity. That's why we'd like to. And like I mentioned before, we want to see what's effect of nanoparticle on bacterial clearance, because we thought it's the first, the most front liner for nanoparticle exposure will be occupational workers, because they are dealing with nanoparticles daily basis. So at the same time, they can interact with their family members. They can get some infection or virus infection or the bacterial infection too. So basically, we want to mimicking that scenario. So we deliver nanoparticle to mice first. So it's mice just exposed to nanoparticle. After that, we deliver the pneumonia bacteria, and then see the mouse can control the bacterial clearance. So we expect in healthy mice, healthy mice, they are able to clear bacteria out. But if mice are exposed to nanoparticle for whatever reason, they are sick, so they cannot clear bacteria. So we use the dose of the bacteria is normally just cleared out easily in health condition. So like I mentioned before, the bowel is basically we wash lung and then collect the fluid as well as cells to looking at their toxic response. So one of the indicator is cell. So if you have neutrophil means indicating of inflammation. So higher level of neutrophil cells you found in bowel, which is high toxicity is happening. As you can see, sham in animal experiment we call control. As compared to control, just focusing on just neutrophil number, which is the red arrows pointing out, you can see the neutrophils level is really increased as compared to control group. And the right side section of the graph is installation exposure. Even installation exposure, you can see the same pattern. Neutrophil number is increased. The cytokine, chemokine as an indicator for inflammation too. As you can see, their level is increased as compared to control. So obviously, copper nanoparticle induced the inflammation and cytotoxicity, even though with the low dose. So now here is the main data. So sham exposure, like I mentioned before, that's a control. It's healthy mice without any nanoparticle exposure, they can clear out the bacteria very well. But nanoparticle exposure group, as you can see, their bacterial number is going up, which means they might develop the pneumonia. So sham exposure and copper nanoparticle exposure, just focusing on their bacterial number. So in nanoparticle exposure group, their bacterial number is up, which means the mouse cannot clear the bacteria. And then using the IKQ, so we're trying to measure heavy metal concentration in mice after nanoparticle delivered in the lung. So one is the lung tissue, sham exposure is control, and copper exposure group, as you can see, copper concentration increase, which means the nanoparticle deposit in the lung. And the right side with the different 3 different doses of nanoparticle in the mice, as you can see, low dose, their copper concentration lower, and high dose dependently increase the copper concentration in lung tissue, which means we deliver nanoparticles in the lung efficiently. In bowel fluid, at the same time, nanoparticle enter or deposit on the lung cells. They release copper ions in the solution, and then the copper ions reach to the bloodstream, and then they can reach to different organ as well. So that's why we like to measure copper concentration in lung tissue first, as well as in wash solution too. So as you can see in copper exposed group, copper concentration increase, which means we deliver copper nanoparticle in lung, as well as the copper ions released from copper nanoparticle to reach out to the bloodstream. So I just want to talk about here is in vitro model, because we don't want to use a lot of animal to test toxicity, but then at the same time we want to validate in vitro study to screening as a toxicity of nanoparticles for animal study. So normally what we do for in vitro study is we call submerged condition and air-liquid interface, especially for lung cells. The submerged condition is basically particles you suspension in the media. I can show you in detail later. So when you do in vitro study, you have to identify or select right cells. Since we are focusing on human exposure pathway for nanoparticle through the inhalation, we are selecting lung cells. But then, as you can see, this is a mathematical model. They have 3 different respiratory systems: upper level, trachea level, alveolar region. The particle deposition efficiency is completely depending on the particle size. So, as you can see, the nano size more deposit in the deeper lung, which is alveolar region. So this is a nano size particle. This, as you can see here, the 20 nanometer particle is a deposit in the lung, alveolar region. That the smaller particle travel deeper lung. So the larger size particle deposit in the upper level first. That's why if you want to looking at the toxicity of the nanoparticle in vitro study, you have to select alveolar epithelial cell because of deposition efficiency, which means potentially nanoparticle deposit in the deeper lung. So that's why we are choosing alveolar epithelial cells in the lung system. And also I want to focusing on how real physiology of lung alveolar epithelial cell. So this is the lung epithelial cell. So our lung system actually facing air. And then below, this is type 2 alveolar cells. This is the bloodstream. So cells growing to receive nutrient from the blood. So actually the cells is facing air. The bottom of the cells, they have the bloodstream. The reason I want to focusing on that, the human physiology, is I want to looking at current toxicity testing system. So basically we call it submerged condition. So we culture lung cells in the bottom of the flask here. This is the lung cells. And then we add the cell culture medium, which is mimicking bloodstream. But the realistic, the real kind of human physiology is actually opposite way. So alveolar cells is there. Bottom of the alveolar cells, they have a medium. But when we do nanoparticle toxicity testing system, actually, we add nanoparticle here in the media. And then in the media, they have a lot of protein and growth factors to grow cells. But like I mentioned before, the nanoparticle has huge surface area, so they can interact with them. So nanoparticle interact with the protein. Some of the nanoparticles can be uptaken by the cell, which is good for toxicity testing. Some of the particles agglomerate each other. So a lot of uncertainty in terms of dose. So toxicity is basically dose response. You add how much is there, what the response is. But this case is a lot of uncertainty. So recent Harvard study shows that most of the nanoparticles stay in the media for a couple of days, which means we add 100 nanoparticles, for example, but some of them is deposited in the cell, some of them still is remaining in the media. So a lot of uncertainty. So we apply to air-liquid interface exposure. Basically, we want to deliver nanoparticle to lung cells directly with air. And the nanoparticle, actually the lung cells cultivated on the semi-pulmonary membrane, and then cells receive the the nutrient from bottom of the media. So we're going to deliver nanoparticle to the lung cells. So it sounds like easy, but it's really difficult to do that because you cannot see the actual particle just movement. So this is a schematic of the animation for the nanoparticle delivery we do. So here is basically the aerosol inlet, and here is the semi-permeable of membrane. So we culture lung cells, and the bottom of the cells we put the circulation media to grow the cells, and then we deliver nanoparticle to cells, and then we want to looking at the cellular response, more kind of mimicking the human physiology. So our nanoparticle in vitro system, actually we have two components. One component is nanoparticle generation system, and then we have the commercially available vitro cell air liquid interface exposure system. So basically we culture cells, like I mentioned before, we deliver nanoparticle. This is our nanoparticle generation system. Since we are interested in metal-based nanoparticle, we are using Spark system. So we developed the Spark system. Basically, if you want to generate copper-based nanoparticle, then you need just only copper electrode. So we have two copper electrodes here, and then we provide the high current and power supply, and then they generate spark. So spark is just vaporizing surface of the copper electrode, and then we provide air, and then we generate copper nanoparticles. Their size is, as you can see, this is a 4.6 nanometer. Also, we can generate less than 5 nanometer by changing the current and power as well. So we successfully developed the Spark nanoparticle generation system, and then we're looking at the cellular toxicity. So cell viability is actually we're using the Alma Blue assay, which means the indicating of the mitochondrial activity in the cells. So cell viability is the 100% means the cell is completely healthy. So 10% cell viability means 90% of the cell is dying, only 10% of the cell is survivable. As you can see, the control and air. So since we are using air to deliver nanoparticle to lung cells, air is actually our control. So air didn't kill any cells significantly, and copper nanoparticle, you can see that after our copper nanoparticle delivered to lung cells, there 20% of the cell is dying. So cell viability is 80%. So NAC is N-acetyl cysteine, which is scavenging of reactive oxygen species generated by the chemicals or nanoparticle. So we use a lot NAC to see how the system is worked. So NAC means, let's just keep. As you can see, copper nanoparticle exposure itself killed 20% of the cells. But when you add NAC, which is removing reactive oxygen species that causing toxicity, you can see their cell viability didn't change. So NAC system works good. So intracellular reactive oxygen species is basically indicator for oxidative stress. So if nanoparticle induce higher level of intracellular reactive oxygen species means toxicity response. As you can see, control air compared to control, the copper nanoparticle exposure induce increase of the reactive oxygen species, which means a toxicity response induced by the nanoparticle exposure, and NAC, which is remove reactive oxygen species, so their level is the same as compared to control. So LDH, one of the indicator for cytotoxicity as well. So you can see the copper nanoparticle exposure, goes up. And then here's cell viability compared with the different nanoparticles. We are interested in looking at the toxicity comparison between copper and iron. So here we are using ICAP-Q ICP-MS to measure solubility difference. We thought different solubility of metals induce different toxicity. So as you can see here, first the cell viability data. Just only I want you focusing on the ions and copper. The cell viability decrease means the cell is killed. So copper exposure group, they killed more cells as compared to iron. We thought it's the same size of copper and iron nanoparticle exposure. We thought this copper release copper ion relatively easily than iron nanoparticle. That's why they induce more toxicity. That's our hypothesis. So intracellular reactive oxygen species, the same, increase the level of ROS, which means toxicity indicating. Copper induce more reactive oxygen species than iron nanoparticle. So to support our hypothesis, we'd like to measure copper and iron concentration in cells and media. So since we deliver nanoparticle to lung cells with air, we can do dosimetry, which means measuring copper concentration or iron concentration using ICP-MS. So we deliver nanoparticle lung cells, and then we digest the cells and nanoparticle and measure metal concentration, as well as we measure metal ion concentration in media. The reason is that if the media has more metal ions, they can translocate to different organs through the bloodstream. So the copper case, especially, you can see the copper 1.7, the microgram of the copper actual deposit here, and 2.59 microgram of copper ion concentration in the media, which means 62% of total copper nanoparticle we deliver that's already dissolved in the media. So when you compare directly about the metal ion concentration between copper and iron nanoparticle concentration in the media, you can see just only 5 or 10 below the 10 microgram per liter. So the scale is completely different here. So copper case, you can see the 500 microgram per liter copper. So even though you do the same delivery of nanoparticle, the same size of particle, but different composition, the same cells, you can see the copper cases, they easily dissolve, and then they release the copper ions in the media, to the media. So this is the one table I really like to show you, because from the beginning I mentioned that we would like to develop some toxicity testing system for screening nanoparticle toxicity for animal study, because we cannot do animal study for all nanoparticles. So which is in vivo work, mice exposure. So in our work, you can see the copper as compared to copper toxicity as well as iron nanoparticle. A lot of different toxicity indicators shows copper is more toxic. And then we want to use our system. Our system is not perfect, right? So we admit that. So our system, we would like to use our system for screening nanoparticle for in vivo work. But at the same time, we want to use current gold standard toxicity testing method using human cells that normally people doing. So we call submerged condition. So we're going to use submerged condition to screening the nanoparticles toxicity ranking for our in vitro work, and then we want to testing more in depth, and then we want to recommend the nanoparticles for in vivo work as well. So kind of a tier strategy. As you can see, our in vitro study is really consistent with the in vivo work. Is copper more toxic than iron nanoparticle? But currently, the gold standard submerged condition, as you can see, their toxicity ranking is really similar. So we thought is the less sensitive than the air-liquid interface system that we use currently for toxicity. If time is allowed, I just want to wrap up my work, the pneumonia work. So from our animal study, we showed that the nanoparticle exposure the decreased bacterial clearance in healthy mice. So we are focusing on the recent the Streptococcus pneumonia. So Streptococcus pneumonia is a worldwide problem. Is the pneumonia is they resulting in 4 million deaths per year. So recent evidence shows that for whatever reason, welders developed pneumonia as compared to healthy person relatively easily. So why is that? We don't know yet. So we thought maybe just nanoparticles in welding fumes increase bacterial adhesion ability to lung cells, because before the lung infections, bacteria first deposit in the lung cells, and then they should be happy there, and then they just growing up, they develop the pneumonia. So we thought, for whatever reason, metal nanoparticle in welding fumes increase bacterial adhesion ability in the cells, and then they grow bacteria. So recent welding fume study shows that predominantly their welding fume is made of nano-scale. So 92% of the particle is smaller than 100 nanometer. 50% of the particle is actually less than 41 nanometer. Current regulation for welding fume health impact is based on the mass, not the size, even though just mass is below the 2.5 micron size. Yeah, this is last slide, sorry. So our initial data shows that the nanoparticle in welding fumes, they increase bacterial adhesion in the cells. As you can see, the different dose of increase, the copper nanoparticle dose, you see the bacterial number is increased. So that's why we thought is nanoparticle in welding fumes, not the mass, is the contribution to the welders, the pneumonia development. So I'd like to thank all our funding source and my group members at Dalhousie University. So I'm just want to wrap up, and thanks for your attention.